Hi, everyone. Welcome back to Vircho's Social Impact Series. I am Ashley Perry, and I'm thrilled to be joined today by Lori Andrade from HEALI. Lori serves as Executive Vice President for HEALI. And for those of you who aren't familiar with HEALI, they are one of the social care network leads operating under New York State's 1115 waiver. So first of all, Lori, great to see you, and thanks so much for joining us today.
Thank you. Good to see you too.
Laura, I was really excited for this conversation for a couple of reasons, but in particular because in my mind, Healy exists in a very unique space across the broader ecosystem of social care network leads that are working under these waivers across the country in different states and different environments. And I think there are a couple of things in particular that stand out about Healy to me. One of them is that you intentionally serve a very large, very diverse, very suburban population across Long Island. And I think typically when we're having conversations about what it takes to operate these network leads, we tend to think about intensely urban environments and what that looks like, or highly rural environments. And we don't spend as much time talking about what it means to operate these networks efficiently in suburban markets, even though that's a vast majority of the markets that they're actually serving today. So would love to hear your perspective on that as we get into the conversation. The second thing that really differentiates Healy in my mind is that you all have very intentionally designed and implemented a no wrong door policy to how you engage members in the network and how you keep them engaged across a long period of time. And I think that's something that a lot of the other network leads that we've spoken with are struggling with. So to kick us off, I was hoping you could share a little bit more about the history and evolution of Healy, the market that you serve and why that's different, and then specifically why you decided to lead with that no wrong door policy and what that means for the communities and populations that you're serving.
Sure. So Healy began out of a first 1115 waiver back in 2017. We received a CBO planning grant in order to be able to begin to engage in this work. And when we brought our CBOs together, it was about 80 CBOs at that time, which has grown since then. We were asking, well, what do we need to do to be able to ensure that somebody can enter into a system of social care and tell their story once and have that information shared? Because on Long Island, there's a lot of CBOs, and the suburban region lacks a centralized government. We have 2 counties, 12 towns, multiple villages, 124 school districts. We have a lot of layers of government, but there's no centralized government really making sure driving social care and making sure that there's that kind of administrative backbone of social care. And so that the CBOs, when we brought them together, said that's what we need to do collectively. So we formed Healy really to become a social care network, to be able to have that infrastructure, the technology and the contracting and the data sharing and the training and all of the components of what makes a hub, to be
Mhm.
able to do that, to address the lack of infrastructure in social care because we're a suburban region. And the no wrong door portion of it is really about, because we're so sprawled across, we want to make sure that people can enter once into the system and their information is shared, and there's a way in which to access care across the entire system.
Mhm. That makes sense and is so important. But what does that look like for a typical member when they're coming in from any one of your many right doors?
Right. So somebody could be going into a food pantry or a soup kitchen or that sort of one of our CBOs that provide that, and they'll be screened at that time and we'll know that there's that nutrition need or whatever needs are there. So they've come in through a CBO, they're screened for using the HC screening tool, and then their information shared, and we're able to create those referrals using our referral platform to be able to access other services that they're eligible for, be they the services of our waiver or other services that are in a community. So it could be any type of a CBO or any type of a healthcare provider that's part of our network, which we have about 100 CBOs and about 20 healthcare providers, which range from large health systems to our federally qualified health centers to other primary care practices as well. So if they're entering in any of those points, where they currently have trust, they have engagement, and they have, an access point for them, they're going to be able to be screened, and then that information is shared and the referral occurs to be able to ensure that that person is connected to care.
So that's quite a bit different than what we see in some other models.
Hmm.
And so I imagine that that has an impact both in terms of how the network is operating
Hmm.
from an efficient and scalable perspective, but also the human experience of being part of that network.
Hmm.
And often when we talk about these things, I think we err on the side of talking about system and process and data
Right.
and macro numbers. And so would love to hear a little bit more about what that human impact is of this
Hmm.
very unique approach.
I think there's two pieces. One is I think CBOs are relieved that
Mhm,
they know that they're able to provide the services that they're expert in, but they're going to be able to connect the person that they're serving to the other services that they're not expert in. When we talk to our CBOs, they're often will say, like being a part of a network is acknowledging I don't do everything. My
mhm,
CBO is not expert in everything, and that's okay. And that I can then have a system by which to partner with another CBO more easily and be
mhm.
able to make sure that that person's getting all the services that they need from the experts in the field who do that work most and would do that work to the highest quality. So I think from the CBO perspective, there's some relief and
Mhm.
being able to know that they're not, sending their client or their Medicaid member off with a sticky note and kind of like, good luck, as
Yeah.
opposed to, no, there's a system of care. And you could say, look, we screened you, we determined you're eligible for some services. We did a referral. Somebody from this company or this CBO is going to contact you. And so when you know, when you hear from them, you'll know why. And so
Mhm.
it's a very different level of care. So I think from the CBO perspective and the healthcare perspective, there's some relief. And
Yeah.
as well as the CBO is able to track what happens to that member end to end, right? So
Yeah.
that we know that, oh, actually they did receive that service and that case has been now closed. Or, oh, actually they've gotten there, there's contact, they're working on it, but it's not quite closed yet. So I
Yeah.
think there's a lot of relief from the provider perspective because they're able to do their part in providing person-centric holistic care. And the system is communicating for us.
Yeah, no, that really resonates because in the conversations that we have with both providers and CBOs every day, we hear consistently that the anxiety around making a referral and having it go out into the abyss and not
Mhm.
knowing what happens is real. And it is a barrier for providers to be able to make the referrals in the first place or for CBOs to be able to accept them. And so that piece of it is clearly essential. That said, for this to work, HEALI and other network leads need to build a really robust, really integrated, really aligned, really communicative
Mhm.
network. And so I'd love
Yeah.
to hear a little bit more about how you did that because you do have so many different partners participating in the network.
Mhm.
How did you recruit them in the first place? How do you keep them engaged as you do this work together? And how do you make sure that there's that alignment and communication,
Mhm.
given how many moving pieces there are?
So our CBOs are who have been a part of this network and our healthcare providers, we've reached out to them. We've done recruiting into the network to be a part of us. And we've done a lot of training and provided a lot of the administrative infrastructure so they have access to our referral platform. We're in contract with them. They're providing the services and they're getting paid. That's a big piece of it too, right? We have to be able to pay them on a timely way. But we really do some very purposeful transparent, open communication, which is a wide range. We do a weekly email. We have a provider portal where we post all of our materials that are there for our provider partners. And then we also have a monthly meeting, which is kind of our signature. We do a monthly meeting where we kind of review how's our network doing. We transparently provide the data to like, this is how we're doing. This is how many services we provide. This is how many people we provide. We've paid out this number of invoices. That type of
Mhm,
transparent data sharing is really important for trust building within the network. And then we'll have one of our members that are doing an exceptional job at something highlighted, and we'll have them present. So that way,
mhm,
we're always lifting up the people that are doing the work really well, and really lifting up subject matter experts in areas. It's not about us, it's about the network and all of the components of the network. And then we'll also have an area where we're talking about sustainability, where we're saying, hey, what's going on nationally? What does this look like? How do we think we're going to sustain this network? Because some CBOs want to know if I'm going to invest in this. What's the long-term plan in that? So we kind of have that on a monthly basis. And then we do an annual in-person meeting as well. But we kind of do a variety of, pieces of communication and training and support and just really being that administrative backbone for our providers.
hmm That makes sense. And that proactive engagement piece seems
Mhm.
critical, right, in making this work.
Mhm.
I know that you also apply that kind of proactive engagement approach with the members. And
Yeah.
so, can you talk a little bit about what that looks like and how you're not just waiting for them to come to you with needs, but
Yeah.
actually engaging them proactively and supporting their needs?
Absolutely. Part of that is having the most diverse network you can have, right? Because that point of trust and contact for clients is different across. Everyone has that different point of trust, that different point of contact in their community. So having a diverse network is really, really critical, and constantly allowing more providers to come in under the tent to be a part of this is really ongoing. It's never closed. It's always open for more providers to be with us. But it's also being really proactive, realizing that people get a lot of information these days in a lot of ways. We used to say you have to touch somebody 10 times in order for there to be a change in behavior or response. I think it's more at this point, even. So, we try to do as wide a range of contact points with community members, being that, making sure the network is communicating out themselves, the CBOs, but also are we, doing kind of the Facebook ads and the social media ads, as well as flyering, as well as, train and bus ads, TV, radio ads, all of the ranges of ways we can touch individuals and make sure we're connecting with them. So we're trying to do all of those pieces, and as well as texting and, quite frankly, snail mail. We get so many texts. We've actually found most
Mm,
recently that snail mail has been a really effective way with, sending something with a QR code, and they can connect right away to it. So I think it's a diversity of points, and just kind of knowing you're going to have to hit it in a number of different ways,
mhm,
and really being proactive into community. The other thing we recently started is an ambassador program where our CBOs can get paid to do presentations in their communities, and make connections where to reach members that are not part of the healthcare system yet, are not part of the social care system yet, but maybe doing a presentation in a library or a church, or even as informal as a barbershop, and then being able to reimburse individuals for their time to do that.
That's amazing. I mean, I think so much of this is historically we've asked CBOs to do this kind of work, but not provided any reimbursement for it. And
Yes, this is true.
and so it's incredible that you're able to do that.
Mhm.
Let me ask you, I was going to ask you what sort of playbook you would recommend for other network leads that are trying to do this. A lot of what you just said spoke to that, but I would just
Mhm.
ask, as you think about other leaders in the space who are trying to build similarly robust networks and be as proactive as you have been in engaging members and connecting them to services, are there other things that you would flag for them that they should consider?
Again, I think it's really the diversity of the network, and it's continuing to bring more folks in so that they can be a part of it. People in this space want to do this service work, so I think making sure that you're continuing to add CBOs and healthcare providers and other trusted community leaders into your network is really critical, to make sure that you're reaching deep in. You have far-reaching tentacles into community and really able to engage as many different communities as possible.
Mhm. Yeah, no, that's critical, whether you're talking about urban, suburban, rural, right? Across
Yeah.
the board, that's key. One question that we hear from a lot of the network leads that we speak with is that there seems to be a bit of tension in balancing volume and quality of service. And so I'm just curious how you at HEALI have approached that because it seems to be a challenge for a lot of similar organizations.
Sure. So we know that as part of our waiver, we need to connect with 600,000 Medicaid members to screen them, which is just that on-ramp into service delivery. And a subset of those, about 200,000, will be eligible for these enhanced new services through Medicaid. So that's a very different proposition, right? One is to hit a high volume with a short screening tool. Another is to be able to do that in-depth service delivery, that care management and service delivery, to be able to connect people to medically tailored meals and home remediation services and asthma remediation services. That's a much more in-depth relationship that we need to create. So I think part of the ways in which we bridge those two is through the community health workers, because even if there's a light touch screening, the community health worker has that empathetic connection way, that person-centric care model.
Yeah.
And so we're able to really have CHWs that are able to touch folks, but then able to be able to determine if someone needs additional care and be able to have that sustained relationship to be able to ensure, because it could be 6 months that someone's receiving nutrition services, and there needs to be that continued connection point.
Hmm.
So we're really using community health workers in that model of care.
Yep. And then how do you think about that in the context of kind of balancing the human driven piece of this with the community health workers and then the technology infrastructure behind it to enable them to reach as many members as possible and to be as effective in the work that they're doing? Because candidly, we hear that a lot of organizations struggle with that or feel like they're burdening their CHWs with a lot of administrative work that's not allowing them to focus on the member facing work that they would prefer to be doing and that candidly we need them to be doing. So
Mhm.
curious how you think about combining both the human component and the technology component.
I think you have to lead with the human component and the technology as a support. So many times I think what ends up happening is the technology is leading and like it's almost leading the human component of it. You really need to flip that around and make sure that how we're providing care for people is central, right? The technology should be an enhancement to hopefully make it easier, not harder, to not add administrative burden, but to take away some of that burden, and to be able to provide some insights through data as to what's going on with the individual and what's the impact that we're having with that individual. Of course, there's some startup to that, right? Because whenever you enter new technology, there is a startup component to that where there is more intensive training and supports. Certainly having a hub, being able to provide those intensive trainings and supports is really critical as opposed to a CBO having to do that on their own, right? Because you also then are able to bring people together in TA cohorts to be able to speak with each other too. And so that we're really making sure that the subject matter experts in the CBOs are lifting up. So I think it's really a big partnership component to it. You have the technology needs to be a partner with the CBOs and with the providers, but it's really making sure that there is that hub model. It really makes a big difference in being able to ensure that one doesn't be overcompensate for another part.
Yeah, no, that makes perfect sense. And, it's interesting we see in different markets, sometimes people are leading with the human piece, sometimes the technology piece, and getting that
Yeah.
right, tuning it
Hmm.
right so that it's working for both sides really does make a difference,
Hmm.
especially when we talk about, you mentioned the numbers that Healy is looking at in New York State. I mean, it's a different thing to be operating these programs at that kind of scale versus where
Right.
we come from, where it's been historically pilots that are a bit smaller. It's
Hmm.
easier to manage those when you don't have to have a lot of infrastructure behind it. But now, as
Right.
these programs start to mature, we're seeing that there's a need for that to be able to really optimize and be as efficient as possible in
Right.
managing these programs at scale. So it's great that you all have been able to figure that out. I guess looking forward, as you think about, where does Healy go from here?
Hmm.
Specifically, what are the either opportunities or challenges that you see on the horizon that you and your team are thinking about?
Right. So we're historically a network of CBOs, but we've added in the last couple of years our healthcare providers, and certainly with a strong focus on our patient-centered medical homes, our
Mhm.
primary care providers. Ultimately, care should be in community. It should be focused on primary care, and social care and behavioral health care should be integrated in to that central primary care provider. So we're learning our primary care providers, and and they're very diverse. It could be a large health system that has primary care providers. There could be a federally qualified health system, or there could still be that mom and pop
Yeah.
primary care provider. And so I think the next step for us is really ensuring that primary care is in the center of care and that we're integrating in social care and we're integrating in behavioral health care, but someone has a place where they know that they're going to go to get their preventative care, to get
Mhm.
their screens for diabetes and for cancer and all of the other areas where they need to be continued to be screened. And that when they're there, they're also going to be connected to care, social care as well. If what's preventing them from being healthy, right, is social care needs, and we want to make sure that that happens. But I think the next phase is really focusing in on primary care, making those connections, understand how as a network, as a hub, we can ease some of the burdens that primary care providers are feeling in
Yeah.
providing care. How do we bring in that CHW to help drive people to provide primary care and be able to really support that service delivery?
Yeah, that easing the burden part is
Mhm.
key because so many providers, when they think about addressing social care needs, it really feels like another thing to add to what is already a very long to-do list, and one that they might not feel particularly well equipped
Yeah.
to address on their own. And so the idea of bringing in a partner that they trust, that they communicate with, that they have visibility into what they're doing, I think really is transformative because we're not then putting one more thing on providers, but we're really offering a partner to work with them on addressing a
Mhm.
need that I think most providers would acknowledge is clearly there, but they don't feel
Mhm.
like they always have either the time or the resources to be able to
Right.
address it directly. And so forging those kinds of relationships, I think, is critical for getting over those challenges.
Absolutely. And it's really what I was saying before. Our CBOs have come together in a trusted network of providers, understanding what they're expert in and what they're not expert in. So it's
Yep,
the same thing. It's now translating that over to primary care and having that relationship and that trusted relationships between providers within a network so that we can all do what we do best, right? We don't need to be doing the pieces that we don't. Like primary care providers have more than enough on their plate to
yep,
do what they do best. So let us do what we do best and being able to have those community health workers assist and provide additional assistance to that patient-centric care. And really over time, that trust and having the infrastructure of the hub is going to allow us to bring this to scale,
yep,
right? It's not CBO by CBO, primary care provider by primary care provider. It's building a system of care that can be brought to scale.
yep. So that to me sounds like a great opportunity. What would you say is the challenge that's facing you and your team as you continue this work?
I certainly, well, for us, because we have a time limited waiver, that's certainly challenging there. It's because when you're trying to bring something I would often say we're trying to build the plane, fly the plane, and land the plane at the same time in terms of this work. And we're trying to bring it to scale very quickly. And there are pieces of it where we know good care is provided. And then there's, data issues that come up and you're like, oh, that's preventing us from focusing on the good quality of care that we want. So I think that's one of the biggest challenges is trying to bring this to scale quickly.
Mhm.
Um, and being able to kind of keep the end game in mind in terms of that overall high quality person centric holistic care that we want to provide.
Yeah. And you're not alone in that. There are a lot of organizations right now that are sort of navigating that pivot to we
Mhm.
figured out how to do this in a pilot capacity or for a more limited population. And now we're trying to make the leap to
Mhm.
operating an efficient network at scale and figuring out what that requires from a people, process, and technology perspective.
Mhm.
But Healy is certainly leading the way on so much of that. So thank you, first of all. And secondly, as you reflect on everything that you've learned and achieved as a team and all the work that you've done, what would you say that you're most proud of?
Definitely the diversity of our network and the
Mhm.
commitment of our network to do this.
Yeah.
There's pieces of it that we're able to, provide support for, financial support towards our network because we're part of a waiver. But there's a certain piece that just, the top of that network of that CBO or that provider needs to make a decision that this is what they want to do, right? Like they're making a commitment to do this work, that they're prioritizing it above other things, and then that gets, spread throughout the entire CBO or healthcare provider. And I think I'm most proud of how many come to the table really ready, willing, and able to kind of roll up their sleeves and get to work and really have that trust between providers. As well as of the network itself. It's been, we've been doing it since 2017. It's a long time now. We've been at it. And I would definitely think that's the piece that I'm the most proud of is just the diversity of the network and the really strong commitment of the network.
Well, and I think that's a testament to the commitment and consistency that Healy has demonstrated in leading that and being a really trusted and reliable partner. So kudos to you and the
Thank
team for
you.
all of that. Lori, you've been incredibly generous with your time, so thank you. Just a last question as we wrap up. As you think about what you've learned throughout this whole process and the advice that you would give to other leaders in your seat, what are
Mhm.
the things that you wish you knew a few years ago or that you would share with them that might help make their journey a little bit easier?
I definitely think communication is really the key to all of this. Consistent, clear, transparent communication. You can't be transparent and clear enough, right? And you have to, hit it every time. You can't miss. You can't miss a meeting. You can't miss a communication opportunity because that's what builds a strong network and builds that trust is really, really being, even when you're talking about our community members or our clients, if our CHWs says they're going to call them back, even if they don't have an answer, they're going to call them back because they
Mhm.
said they were going to do it. So it's that consistent, clear, really transparent communication that's so critical from serving clients and members to also just building out a strong network.
Excellent. great advice for all organizations. So Lori, thank you again for your time, the insights, and the
Absolutely.
work that you do. We really appreciate it.
Thank you.